Today we're going to talk about Ledderhose disease. Nope, not Lederhosen, but Ledderhose disease. And this is something that is quite common where people form nodules on the bottom of their foot in the plantar fascia, usually that medial band of the plantar fascia. This is what it looks like. It's just a thickening of the fascia that causes these hard nodules that can be very painful to walk on. So they could look like this, where it's just a very small nodule. You can't see it? Really? Okay, right there. That's where it is. And this would be a rather small one on the bottom of the foot. It could also be a lot larger, like this one, or really big, like this one. So today we're going to look at one particular type of treatment. All right, so the first thing I'm going to do is feel where the pulse is. It's right here, because the nerve sits just behind that artery there. Okay, so do you want me to lay you back?
Yeah, a little bit.
Okay. And you've done fine with these the first two times.
Yeah.
They weren't
just that
horrible.
initial.
Yeah. Okay. So, little stick. Okay. Now, did you just feel the zing?
Yeah.
Okay. So, we're gonna advance this again. Let me know when you feel that zing. No?
No. Right there.
Right there. Okay. So we're going to make sure we're not in the artery, and then we push the plunger down. We'll go a little bit deeper in. Okay, I want to just do one more little spot here. Anything?
No. Right there.
Okay, good. That's right where we need to be then. Okay. One down.
One down.
The reason, I'm just going to do a little teaching moment here. The reason we inject here is because the nerve that gives sensation to the bottom of the foot comes from deep in the leg, goes right around that ankle, and then goes onto the bottom of the foot, and it splits into several branches that go up toward the toe. So with one injection here, we can knock out sensation on the entire bottom of the foot. That's why we're injecting here. All right, let's switch.
Actually watch the injection.
If you want to. As long as I know we're in frame, we're okay. You don't have to. Stick, burn.
Yeah, I felt the thing there.
Now on this foot, if you look very closely right here, you can actually see her pulse in that artery right there. You can see it pulsating right there. Just kind of cool. That's how we know we're in the right spot. Okay. So now this will take about 10 or 15 minutes to completely numb the bottom of the foot. So let's just talk to our patient for a minute. Okay, so tell us a little bit about your journey with Ledderhose disease. Oh, I don't know why. Okay.
So a year ago this month, I was diagnosed with some nodules, and the doctor I was seeing referred me to the U of M for radiation therapy.
University of Minnesota.
Yep.
Okay.
Yep. And because I have dupuytrens in my hand, and I saw Dr. Dusenberry at the University of Minnesota who treated my hands 6 years ago, and so she decided to also radiate my feet, and so we did that in April and May of 2020. And the nodules, they didn't get any bigger, but they didn't go away either. So I saw a couple other podiatrists in Minnesota here, and I found Dr. Sperling, and she was willing to talk with Dr. Davis, who's in San Antonio, and he explained how to do the enzyme treatment, and today I'm having my third one, and we have had great experience and great success with this.
So even though you had the radiation first, which Dr. Davis indicated oftentimes will make this less effective, you found after the first one you had at least 50% improvement, yeah?
Yes.
Okay. And are these nodules painful to walk on?
They were before we had my first injection, yes.
Wonderful. Okay. And the second injection, did it move you forward? You said not as much as the first injection, but they still got a little bit better after the second one?
Yes.
Okay.
And now I have no more pain in my right foot. That
Wonderful.
was the worst one. Yes.
Wonderful. Now, how about your hands? Do you have any nodules on the palms of your hands like some people do?
I do have some nodules, but they are not getting any bigger.
Can we see them?
Yep. I have one right there.
Okay. Show me the left one again. Right there. Okay.
And then I have a couple small ones right here.
Okay.
So I have had 2 different rounds of radiation therapy on my hands. She did a couple more sessions last year when she did my feet. And so, yeah, I don't have any contractures. I'm able to open my fingers and my hands, and I have no more pain in my hands.
Okay, great. Well, thank you for letting us know about that. And then as soon as your feet, the bottoms of your feet get numb, we'll go ahead, and there's also some numbing medicine in the injection I put into the nodules. So I know your left one didn't get completely numb last time, but it wasn't a horrible.
No.
It was mostly numb. So,
Yep.
Okay. So we'll come back when we're ready to inject the nodules. Okay. So this is a foot that was the worst of the two.
Yep.
And now, show us where the nodules are.
Okay, so I had a nodule like right here,
Mhm.
and then right here.
Okay, which we can barely see now.
Yeah, they're pretty much gone.
And so you did try some physical therapy for it.
Yep, I had physical therapy, and when I first started physical therapy, the therapist couldn't even rub like right here where this nodule was because it was so painful.
Okay.
And now there's no pain. It's all gone.
Wonderful. Yeah, and I can barely feel them, and it's really hard to even see them. So I'm just going to outline them before we inject.
Okay.
So let's do that. We'll just have you keep your foot right there. So the one that was up here, I can barely feel it, but this is kind of the outline of it right there. And then the other one is right there. Okay, so we're going to hit it right there and right there. All right, so yeah, we should have gotten a before picture.
Yeah.
Did we?
I think maybe you took pictures.
Okay, I'll find them and stick them on the video. Okay, so you're thinking this is completely numb now?
Yeah.
Even though it doesn't feel real warm to me, but that's okay. Now, I know that when Dr. Davis does this, he uses ultrasound, which we don't have. But, all right, so do you feel anything sharp when I press right here?
No.
Okay, so we're gonna go directly into the nodule, which feels pretty solid.
Sorry.
Are you okay? Okay, and it's gonna blow it up a little bit.
Can't feel it at all. It's numb.
But the needle's going into the skin.
Yeah, you know, first time I ever watched a blood draw, I had to go leave the room and sit down.
And now you do surgery on feet.
Well, it's because the needle's pointing the other way, and so you get used to that. Okay, this one, we're gonna go right here. Yeah, and I can feel that's pretty thick. So we're gonna go right into the nodule there. And what you see coming out, that's a little bit of cortisone that's mixed with the enzyme. But this is a wonderful result because I can barely feel these. Okay, and then we have just enough for the left over. So let's just, did I put Band-Aids on those?
Yeah.
Now, when the anesthetic wears off, are these sore the rest of the day?
It feels like you're walking on rocks, but that is gone by the time you go to bed. Then you wake up the next day and
Pain is gone.
the pain is gone.
Wonderful. All right, so let's look at your other foot with the beautiful pedicure. Okay, and I'm going to check and make sure it's numb, and if it's not, we'll just give it a few more minutes.
Yeah, I don't think it's numb.
Not yet. Now this nodule, can you just look and make sure that we're still in the frame? This nodule's just right here. So I'm going to outline it first. I mean, these are small compared to some that you see on the website. Okay, just sit back and I'm just going to see if, I'm just going to touch you with the needle and see if you can feel the sharp. Do you feel anything sharp when I do that?
Yeah.
Okay, so we're just going to give it a little more time then. Does that say record? Okay, so I'm just going to check this again. Does this feel sharp to you?
No, it's good.
Okay, so we're just going to go right into the nodule and put in the rest of this. It's hard to get in because the nodule's pretty solid. And we are done. All right, so I'm wondering if we're even going to need to do a fourth one, but have you back in a few weeks and see how it's going.
Yeah.
We have the one more vial.